Hi everyone, thank you for joining again for another episode of GLANZ Wellness Podcast, where you learn everything about aesthetics and wellness. In this episode, I'm going to be discussing the famous skinny shot called semaglutide, the truths, the myths, what it does, how it works the best, and what are your most common questions when the patients come in to see me. What are the questions that they're asking, so that if that's a question that you have, we can finally put an end to that question. As you know, I usually divide the segments in questions because it's easier to understand, and some of them are questions that you send to me or common questions that the patients ask during their consultations. Question number 1, what is semaglutide and what does it treat? When we talk about semaglutide is a GLP-1 agonist. And what it does and what that means is this medication is going to act on receptors that are going to balance our sugars. Bringing our sugars down, we require less insulin, which is going to be not only better for our overall health, but it's also preventing us to eat more, because as we know, insulin is a growth factor, which is going to make you want to eat, and it's going to halt your weight loss when you try to lose weight. So controlling our sugars is the first thing that semaglutide does. Another thing that it does in our bodies is it blocks some appetite receptors in the brain, and it decreases a lot of our cravings and our appetite, which if we go on a diet, most of the time when patients are not compliant with a diet, we know it is because they're having anxiety, because they feel that they want to eat, and a lot of those symptoms are controlled by semaglutide or this medication. When we discuss semaglutide is the active ingredient or the generic of Ozempic. There are other medicines in the market like Mounjaro or Wegovy, which you can also find as generic. So Wegovy's generic is also semaglutide. Mounjaro's generic is tirzepatide. So I'm going to talk about all those medications during this podcast so that you can learn about all of them and decide which one is the best for you. Semaglutide, as mentioned before, does block our appetite receptors and control our hunger. Also, it controls our sugar. But the third thing that it does is that it decreases our gastric emptying. So what does that mean? Decreasing our gastric emptying is when we eat, we tend to feel full faster, and our digestion of whatever we're eating slows down, which causes the food to stay on our stomachs for a longer time, making us feel full for a longer period of time during the day. This decreases a lot of the foods that we're eating because we're full all the time. It doesn't let us eat over quantities of food or big portions, which is why it causes weight loss. Medication is injected once a week in the area of the stomach or anywhere where there's fat, and you just have to rotate weekly where you're injecting the medicine. It's a very little insulin syringe. It's very easy to administer at home. And some patients, if they have needle phobia or they're scared of needles, they just come to the office and we inject the medication here. But it is a very easy treatment to do at home, and we answer all your questions right before you're going to start the treatment. As you know, as an endocrinologist, I am always wanting to make sure that our patients' hormones are balanced even before they start any of their treatments, whether it is weight loss, hormone replacement, IV fluids. I want to make sure that some of the symptoms that you're having, including eating a lot, increased appetite, or obviously not being able to lose weight, feeling fatigue, I want to make sure those are not symptoms related to your hormones. So during the weight loss program, it is very important that you check your hormones. I check a full thyroid panel, a complete metabolic panel to check your electrolytes and your liver enzymes. I also make sure that we check your pancreatic enzymes, because this is a medicine that is going to have an effect on the pancreas, and also your vitamin levels. If, for example, your thyroid levels are not balanced, it doesn't matter what diet you do, you're not going to be able to lose weight. We know our thyroids are very important in our metabolism, and what happens is if we don't have our thyroids balanced, then the medication is going to seem like it's not working, but it's not actually semaglutide not being able to work on our bodies or giving us the best results, but it is actually are hormones that are the problem. So here at GLANZ, I make sure that before you start a weight loss program, your hormones are checked and balanced. Question number 2. What are the common side effects associated with semaglutide and how can they be managed? If you are on this medication, some of the side effects that our patients experience, even though there are not many of them, there are some side effects that can interfere with your daily life. As I discussed earlier, semaglutide is going to decrease our gastric emptying. So some of the side effects might be nausea, vomiting, and acid reflux. If you are experiencing horrible vomiting or you're experiencing abdominal pain, this is not normal. So you definitely have to contact your provider to make sure that they can see what is going on with your body or see what dose you're on so that this can be altered. That is definitely not okay. You don't want to be experiencing abdominal pain or severe vomiting. Nausea and acid reflux are very normal. Other side effects can be constipation or diarrhea. If you experience this, please tell your medical provider because those are things that can be treated, especially constipation. If you are constipated while taking semaglutide, this is something that is going to halt your weight loss and you're not going to be able to have effective results. So make sure you can, for example, take a laxative, take Miralax, or try Dulcolax or any other medications, but please always consult with your provider that is helping you with the diet so that you can make sure this is okay for you to take even with your other medications. Question number 3. Are there any specific patient populations that should avoid or use semaglutide with caution? Absolutely yes. A common question that I get from the patients is, number 1, if I have hypothyroidism or I take thyroid medicine, can I take semaglutide or any of those like tirzepatide? Yes, you can. Obviously, this is a medication that is made for diabetics and to control sugars, but it's also approved for weight loss. So if you are taking levothyroxine, Synthroid, or any thyroid medication, you just have to consult with your physician. It's not a contraindication to be on these medicines while taking semaglutide, but if you are, please seek the help of an endocrinologist, which is an expert on thyroid medication and all these GLP-1 medications so that you can get the best results with very minimal side effects. Other patients that should not be on this diet, this is an absolute no. It's patients that are pregnant or breastfeeding. Obviously, because there's no studies that have been done on pregnant patients or patients that are breastfeeding, it is recommended that you stop semaglutide for at least 2 to 3 months before you decide you want to become pregnant. So if you're thinking of getting pregnant or it's something that you're desiring and you are within that 3-month mark, you should stop the medication or not even start it. If you are not planning to get pregnant, then there's no problem. You should be okay using the medication. Another patient that should not be on this medication is a patient that has a history of medullary thyroid cancer. If you've had this thyroid cancer, it is recommended that you avoid any of the GLP-1s because it does interfere with your treatments and it does cause an increased risk of redeveloping this condition. If you do have thyroid nodules, you might not know this, but thyroid nodules are very popular. The thyroid, it's a very vascular gland, so thyroid nodules are popular. A lot of people have thyroid nodules and they don't even know they have them. So if you do have thyroid nodules because you've had a sonogram of your neck and they diagnosed thyroid nodules, as long as they're small, stable, and that you've never had any risk of any other cancer, there's no problems for you to be on a GLP-1, semaglutide, or tirzepatide. If you have had a history of, for example, papillary thyroid cancer, then that's no problem. As an endocrinologist, I will tell you to bring me your reports from the biopsy, from the pathology if you had your thyroid removed, and we can discuss this in the consultation and see if semaglutide might be a good medication for you as well. Number 4, is there a difference between semaglutide and tirzepatide? Yes, there is a difference between semaglutide and tirzepatide. Semaglutide is going to act on the GLP-1 receptors, as I mentioned earlier. If we talk about tirzepatide, it does act on the same receptor, but it acts on the GIP-1 receptors. So when the studies were being done for both of these medications, semaglutide showed an 8% of weight loss on the patients in the study, while tirzepatide showed a 15% of weight loss on the patients that were on that study. So if we compare both medications, the doses are going to be completely different, so don't mix them together, because if you take one dose of a different one, you could have really bad side effects, or it's not going to work at all. So we start you on 0.25 of semaglutide, while tirzepatide, for example, is 2.5 milligrams. So the doses are completely different, but tirzepatide did show more benefits and an increased rate of weight loss. If you are wondering which one should I try, tirzepatide or semaglutide, know that tirzepatide does have a faster rate of weight loss, and it is a little bit more expensive, but I think it's totally worth it. The medication is, I think it's better in my opinion. The patients have minimal side effects, the same as semaglutide. So we have both of them in the office if this is something that you're interested in, or you have tried semaglutide before and you're like, you know, that medicine didn't really work for me. I didn't feel the effects of low appetite like I thought I was going to, or I didn't lose as much weight as I wanted, then that's a possibility that you might need another medication. Obviously, when we talk about medications, we start at a specific dose, and some patients are not going to respond to that dose. So if you start on a lower dose of the medication and you don't feel the effects like you are supposed to, then you know that you have to go higher and higher on the dose. You can start at 0.25 of semaglutide. The max dose is 2.5. So there's a big room to wiggle around the dose. Something that I've noticed when I see patients here at the clinic is that some patients, either they go to a spa where they don't check their hormones, or they go to a spa where there's no medical providers. So make sure that somebody sees you that knows what they're doing, that knows about this medication. Adjusting the dose the right way is key on ensuring that you're going to lose weight. And if you start at the 0.25 and it's not really controlling your symptoms, then it means that you need higher doses. I talk to my patients every month and try to figure out what is the best dose for you, because it might be for me 0.50 milligrams, but for you it might be 1.5 milligrams. So you need to go higher. Unfortunately, we cannot go higher on the medication faster than 3 to 4 weeks. I know everyone's like, I want to go higher. I don't feel this dose that much. What do I do? But the patients, it's funny how they come in, and once they hit their dose that's going to work for them, they say, this is my dose. Like I took it and I felt it. I felt the effects. I'm barely eating. Like I feel like I'm losing so much weight now. So don't get discouraged if this has happened to you. It doesn't mean that the medication doesn't work. It just means that either the dose wasn't the best for you, or you need your hormones balanced so that you get better results. Obviously, seeing a medical professional is key to ensuring that you are not wasting your money. Some of the spas have been diluting the medication, and that's very sad to hear. We're dealing with patients, but in Miami, you never know. You want to make sure you go to a reputable place. Don't buy this from your neighbor if you've never used it. They might give you a dose of 1 milligram and you start vomiting for a week. You want to prevent all these things. I know it becomes a point where you want to try to save money, but you're going to be sorry at the end, and you don't want anything bad to happen, not only for you, but obviously at a point where you can't use the medicine in the long run. Okay, last but not least, is there a rebound effect after semaglutide? This is a great question. Obviously, we're dealing with weight loss. If you are a patient that has had to do weight loss since you were little, this is something that is in your DNA. Our hormones, our neurotransmitters, a lot of the things and hormones that we have in our brains and in our bodies, when we talk about leptin or ghrelin, everyone's different on how they regulate these hormones. If you have been overweight, you know that you are predisposed to being overweight forever. So that means that semaglutide or tirzepatide, they're not just magic drugs that you're gonna use and then all of a sudden you're never gonna be overweight again. This has to be a lifetime commitment, and I tell the patients this in their first appointment. If you come to me, you're going to take these medications, you're going to have great results, but you have to change the way you look at food. One of the things is what we eat, right? So I recommend that you eat high proteins, low carbs, and low sugars, so this is more sustainable. Also, to make sure that you incorporate some sort of exercise in your daily life. So you don't have to go to the gym every single day, but at least 2 to 3 to 4 times a week, you should be working out, walking, something that you've never done before, because this is gonna prevent that rebound effect of you gaining weight if you start eating a little bit more after you stop the medication. Obviously, also, we wanna make sure, again, your hormones are balanced. If you have lost weight, it's always good for you to check your hormones routinely. I recommend you do them every 6 months to a year. You never know. This year you might be perfect, and next year, because of something, it could be stress, it could be something else that's happening in your body. It could be related to pregnancy. Patients that become pregnant, all their hormones are out of whack. Patients that start a medication that can affect some of our hormones. So if this is happening to you, you want to make sure that you have a primary care physician or see an endocrinologist regularly so that your hormones can be checked every single year. This happens a lot for example, males. They have normal testosterone levels this year, and because of something that happened, whether it is meds, stress, changes in their daily lifestyle, changes in what we eat, their testosterone level drops significantly the year after, which causes them to have an array of multiple symptoms. All of those things can change your testosterone levels, so that's why I recommend every year you go to your primary care or you go to an endocrinologist to check your hormones. So like I said, it's not that this medication is going to necessarily have a rebound effect, but every single diet throughout the years we know that can have a rebound effect. This is no exception. So for you to be able to ensure that you have the best results, long-lasting results, you want to make sure that you change your eating habits, the way that you look at food, where you're only eating if you're hungry, and you adjust the food choices. Patients that have changed their eating habits and their lifestyle patterns definitely have great results that are long lasting. We have patients that have not been on the medicine for over 8 months and have maintained their weight. But if this is something that's very hard for you, I also have a style where you can keep taking the medication in terms of a maintenance program. In your case, if you know this is going to be hard for you and you are somebody that maybe you can't exercise, maybe you have a knee problem or a back problem, it's hard for you to exercise, I would still recommend for you to walk a little bit, at least move in some sort of way. But if you think it's going to be hard for you to be able to maintain your weight, I also recommend a maintenance program where our patients can use the medication not as consecutively, but they remain in a maintenance program where I see them every so often so that they can have long-lasting results. Obviously, also, I have a messaging system, so make sure if you do the diet at another med spa or at a doctor's office, you have a way to reach them and that they answer the phone. Because if you do have side effects or you have any questions, here at GLANZ, we have an internal messaging system that you can text us at any time to make sure that we can treat your symptoms, give you good, long-lasting results, and that you can have a great experience while on our weight loss program. If you also have questions, you can always DM us on our Instagram, and I'll be happy to answer your questions or make a video so that you can get clarity on a lot of the myths that are going out there of all of these new treatments. Stay tuned for next episode next week. It's going to be another good one, so thank you for tuning in.